In the next 12 minutes, I'm going to share something that could be the difference between maintaining sensitivity for the next 20 years or losing it completely. This isn't about enhancement. It's about preservation and restoration of tissue that doesn't regenerate once it's gone. Here's the harsh reality. Every time you engage in solo activity without proper lubrication after age 50, you're causing damage to nerve endings that won't grow back. The scary part, by the time you notice reduced sensitivity, you've already lost 30 to 40% of nerve function. But specific oils can actually protect remaining nerves while potentially restoring some function to damaged ones. Today, I'm revealing which oils can genuinely improve blood flow, protect sensitive tissues, and yes, help maintain firmness for extended periods. This isn't about miracle cures. It's about understanding how certain oils interact with penile tissue to prevent irreversible damage while improving current function. Your penile tissue is unique. It's designed to absorb certain compounds through the skin more readily than other body parts. This is called transdermal absorption, and it's why certain oils can have localized effects when applied properly. As men age, 3 critical changes occur. Natural oil production drops by 60% after 50, leaving tissues dry and prone to damage. Blood vessel flexibility decreases, making it harder to achieve and maintain firmness. And nerve sensitivity declines from years of friction without proper protection. The right oils address all 3 issues simultaneously. They provide immediate lubrication while delivering compounds that improve circulation, reduce inflammation, and protect nerve endings. This isn't just theory. Studies on transdermal absorption of fatty acids show measurable improvements in local blood flow within 30 minutes of application. Let's start with argan oil because, while it's the most expensive option, it might also be the most effective for men over 50. Moroccan men have used this for centuries, and there's good reason why. Argan oil contains the highest concentration of vitamin E among natural oils, about 620 mg per liter. This vitamin E doesn't just moisturize, it actively repairs damaged tissue and improves elasticity. For aging penile skin that's become thin and less responsive, this can mean the difference between numbness and sensitivity. The squalene in argan oil mimics your body's natural sebum so closely that it's absorbed deeper than other oils. Once absorbed, it improves local circulation by helping blood vessels dilate more effectively. Men using argan oil consistently report maintaining firmness 20 to 30% longer than with commercial lubricants. Apply about half a teaspoon 10 minutes before any activity. Warm it between your palms first, then apply with gentle upward strokes to encourage blood flow. The oil should feel silky, not greasy. If it feels heavy, you've used too much. Grapeseed oil is lighter than most oils but packed with proanthocyanidins, compounds that specifically strengthen blood vessel walls for firmness issues. This is crucial because stronger vessels mean better blood retention where it matters. French researchers found that topical application of grape seed oil improved local circulation by up to 40% in test subjects. While this wasn't specifically studying penile tissue, the mechanism is the same. The oil's compounds penetrate the skin and support vascular function. The linoleic acid content, about 70% of the oil's composition, helps maintain the skin's barrier function while allowing beneficial compounds to penetrate. This dual action means you get both protection and enhancement from a single application. Use about a teaspoon, applying in circular motions to ensure even coverage. Grapeseed oil absorbs quickly, so you might need to reapply during extended sessions. Keep a small bottle within reach. The pump bottles work especially well for easy reapplication. Black seed oil from Nigella sativa contains thymoquinone, a compound that's been shown to support testosterone production when absorbed through the skin. This isn't about dramatically boosting hormones, but rather supporting your body's natural production. Middle Eastern men have used black seed oil for virility for thousands of years. Modern research shows it improves blood flow by increasing nitric oxide production, the same mechanism targeted by prescription ED medications, but naturally and without side effects. The oil also has powerful anti-inflammatory properties. Inflammation in penile tissue reduces sensitivity and impairs blood flow. By reducing this inflammation, black seed oil helps restore natural function that may have been compromised for years. Mix half a teaspoon of black seed oil with an equal amount of coconut oil. Pure black seed oil can be too intense for sensitive tissue. Apply 15 minutes before activity to allow absorption. Some men report a warming sensation, which is the increased blood flow you're actually feeling. Jojoba oil's molecular structure is unique. It's actually a liquid wax that perfectly mimics human sebum. This means your skin recognizes and absorbs it immediately, making it ideal for men whose natural oil production has declined. The zinc content in jojoba oil is particularly beneficial for male sexual health. Zinc is essential for testosterone production and maintaining sensitivity. When applied topically, it provides localized support exactly where needed. Jojoba also contains vitamin B complex, which supports nerve health. For men experiencing decreased sensitivity, regular use of jojoba oil can help restore nerve function over time. It's not immediate, but after 2 to 3 weeks of consistent use, many men report noticeable improvements. Apply just 3 to 4 drops. Jojoba spreads extremely well. Its stability means you can leave a bottle bedside for months without worrying about rancidity. This makes it perfect for spontaneous use without preparation. Extra virgin olive oil might seem basic, but it's one of the most effective options available. The oleic acid content, about 75%, penetrates skin barriers to deliver vitamin E and antioxidants directly to tissue. Greek and Italian men have the lowest rates of erectile dysfunction in Europe, and their olive oil consumption, both dietary and topical, is likely a factor. The polyphenols in high-quality olive oil improve endothelial function, helping blood vessels respond better to arousal signals. Choose cold, pressed extra virgin olive oil in dark glass bottles. The fresher the better. Look for harvest dates within the past year. About a teaspoon is sufficient, warmed slightly for better absorption and comfort. The squalene in olive oil, though less than argan oil, still provides significant benefits for tissue elasticity and moisture retention. This can help reverse some age-related tissue changes that affect firmness and sensitivity. Timing and technique matter as much as oil choice. Here's the optimal protocol. Apply your chosen oil 15 to 20 minutes before any activity. This allows absorption for internal benefits while maintaining surface lubrication. Earlier application means the oil penetrates deeper. Later application provides more surface slickness. Use upward strokes during application, moving from base to tip. This encourages blood flow in the right direction and ensures even coverage. Spend at least 60 seconds on application. This isn't something to rush. Temperature matters. Warm oil absorbs better and feels more comfortable. Run the bottle under warm water or keep it in a warming pad. Never microwave oils. This destroys beneficial compounds. For extended firmness, reapply small amounts every 20 minutes. This maintains both lubrication and the circulation, boosting effects. Having oil in a pump bottle makes reapplication seamless. Not every oil works equally for every man. Here's how to find your optimal combination. Week 1. Try argan oil, if budget allows, or olive oil for an affordable start. Use consistently for 7 days, noting any changes in sensitivity, firmness, duration, or comfort. Week 2. Switch to grapeseed or jojoba oil. Compare results to week 1. Some men respond better to lighter oils. Others need heavier options. Week 3, experiment with combinations. Mix equal parts of two oils that worked well individually. Many men find combinations provide benefits neither oil offers alone. By week 4, you should have identified your optimal protocol. Most men settle on 1 or 2 oils they rotate based on needs. Perhaps a lighter oil for quick sessions and a richer oil for extended activities. While natural oils are generally safe, certain precautions are essential. Always patch test first. Apply a small amount to your inner forearm and wait 24 hours. Genital tissue is more sensitive than arm skin, so any reaction means avoiding that oil entirely. Quality matters enormously. Cheap, refined oils lack beneficial compounds and may contain irritants. Invest in cold-pressed organic oils from reputable sources. The extra cost is worth avoiding tissue damage. If using barrier protection, remember oils break down latex. This includes residual oil from earlier application. Either use non-latex protection or ensure complete oil removal before latex contact. Watch for signs of irritation, unusual odor, or discharge. While rare with quality oils, any unusual symptoms means stopping immediately and consulting a healthcare provider. Men who commit to proper oil use for 30 days typically report Week 1, improved comfort during activity, less post-activity irritation. Week 2, noticeable improvement in firmness duration. Better sensitivity. Week 3, skin quality improvements, reduced recovery time needed. Week 4, sustained improvements becoming the new normal with many reporting feeling years younger in terms of function. Document your journey. Note which oils work best, optimal amounts, and timing preferences. This personal data helps optimize your protocol for long-term success. Using the right oils isn't just about temporary enhancement. It's about protecting and improving tissue health for sustained function as you age. The minimal investment in quality oils could mean the difference between accepting decline and maintaining vitality. This approach addresses the root causes of age-related changes rather than masking symptoms. By supporting circulation, protecting tissues, and maintaining sensitivity, you're investing in long-term sexual health. Start tonight with one oil. Give it an honest 30-day trial. Most men are amazed that something so simple can make such a significant difference. Your future self will thank you for taking tissue health seriously.